Good afternoon, everyone. I hope you enjoyed a little salsa music as we got ready for our webinar. Welcome to another SMI webinar. We're happy to have you here. Today, we're going to be introducing you to a new organization focused on creating a more resilient healthcare supply chain. We learned here at SMI about HERC, which is the Healthcare Industry Resilience Collaborative. We learned about them several months ago, and after connecting with them, we realized that working together, we could be much more effective in addressing this really key issue for all of us these days. SMI has many members that overlap with HERC, and so we share a commitment to building a more resilient supply chain, and we just feel like this is a great partnership for us to work in tandem. We will be working together to maximize the resources that we can each contribute going forward and make sure that we're not duplicating each other's efforts, but are really working in a complementary way. Before I introduce our speaker, I wanted to take a couple of seconds today to just give you an update on a couple of upcoming events that SMI has going on. In September, we have a great webinar that we hope our members and their guests will be able to join us for. We've got a webinar with the Strategic National Stockpile, and they're going to share some information on what they're doing to move to a new model. SMI and the SNS have been engaged in a council collaborating together since early in 2021. We've had several meetings where we've reviewed joint questions, and those questions are going to be driving the conversation on September 28th, where we've learned so much about them and they've learned about the healthcare supply chain in ways that they didn't understand before. So watch for the invitation in your inbox in August. Please, members, feel free to share that invitation with guests. And we will be sharing that invitation across the industry as well. That will not be an SMI only webinar, but will be shared through HIDA and ARM and other organizations to make sure we maximize the visibility that SNS gets on that webinar. And then I'm very, very excited to remind everyone that for our members, our forum registration will go live 1 week from Monday on August 2nd. Our forum is scheduled to be live in Nashville in October 18th to 20th at the Lowe's Vanderbilt Hotel. So we are so excited to be getting back together again in person, together in 3D, not just in this 2D Zoom universe. So we'll look forward to seeing you all then. I wanted to then introduce you to our speaker today. We've got Jesse Schafer joining us. Jesse is the Performance Consulting Manager at Mayo Clinic and also the Program Development Manager for HERC. And Jesse really has been pivotal in helping to create this partnership that we've got now with SMI, along with the rest of the HERC leadership team. We're really delighted to have Jesse with us today to introduce you to HERC's mission and plans. And Jesse, I'm going to let you take it from here.
Hey, Nancy, thanks so much. And good afternoon, everyone. Today, I'm pleased to share with you more about the Healthcare Industry Resilience Collaborative. And as Nancy had mentioned, please feel free to use the chat feature at any time during today's session. SMI, as our host, will review this chat live and verbalize your comments so that we can dialogue together. At the end of today's session, I truly hope that you'll have a better understanding of the value that HERC can bring both to your organization as well as collectively as a healthcare industry supply chain. HERC was co-founded by Mayo Clinic and Spectrum Health in 2019 as an altruistic approach to the healthcare resiliency problem. We wanted to gather as many of our peers as possible and an equal balance of supplier engagement. HERC was founded on three main principles: provider-led, supplier-supported, and patient-centric. Solving supply chain resiliency becomes possible only through a high degree of collaborative effort across both providers and suppliers. As such, this is the HERC model. So what is HERC? We are a network of supply chain executives working together to do what is right for patients through supply continuity. Our mission, vision, and values will come to light throughout today's session. Our outputs include development and promotion of best practice in supply chain resiliency in close collaboration with suppliers and providers. I've mentioned our community, so here we are today. In just 18 months, our membership has grown substantially. We couldn't be more thankful for the thought leaders, both from providers and suppliers, and the overall collective mindset of our provider and supplier members. Excuse me, I meant collaborative. HERC is proud to be a collaborator of SMI. and recently participated in SMI's Sprint Initiative Resiliency Planning Kickoff. In synopsis, the participants framed resiliency as the ability to predict, prepare, prevent, and recover through formalized business continuity programs, transparency of the end-to-end supply chain, monitoring of world events and analytics, and timely and candid communication between trading partners. This is just a snapshot of our recent kickoff. Please contact SMI if you'd like to engage in this project. Now, as we get into today's session, we're going to have an opportunity for you to engage hands-on, starting with a handful of questions. And so in just a few moments, you're going to see a pop-up on your screen that reflects the content that you see here. When you see that pop-up, click on the answer that best fits your perspective, and then don't forget to click Submit. We'll wait roughly 30 seconds, and then at that point, we'll see the collective total and want to assure you that your responses will be anonymous and aggregate. So therefore, please be candid. First question, how many years have you had a formalized business continuity program specific to supply chain management? A, more than 2 years, B, 1 to 2 years, C, 1 year or less, or D, we do not have a formalized program specific to supply chain management at this time. Again, we are not tracking you individually, so please be honest. Go ahead, click your response, then click Submit, and in roughly 30 seconds, we'll see the aggregate. Okay, 56% more than 2 years, and then a relatively even distribution between the other choices. I think that's fairly encouraging in terms of what I would suggest is a trajectory towards greater interest in formalized programs. I'd also suggest it's a trajectory from a recent starting point, knowing that resiliency has received additional attention in recent years and do so. Great. Our next question, have you activated your supply chain management incident command center within the past 5 years? This question applies specifically to supply chain roles and responsibilities. Your choices, A, yes, B, no, or C, we do not have an incident command center specific to supply chain. Another friendly reminder, we are not tracking you individually, so we will not publicly shame you if you feel that your answer is not favorable. Please just be candid. Also, another reminder to use the chat feature if you want to add any questions or comments as we proceed through today's session. So roughly 15 seconds remaining to choose your response and click Submit. And our survey has closed with 60% saying yes. And thank you for your honesty. 37% saying we do not have an incident command structure specific to supply chain. Now you may think, do I need one? Is that necessary? Quite honestly, I think that's a very healthy conversation for us to have. And it is a conversation that we're having amongst the HERC community. Great. Let's take us to our next slide here. This slide reflects the responses of HERC provider members to questions similar to those just discussed. We are appreciative to KPMG, who provided this assessment complimentary to our provider members. HERC provider members reported significant negative financial impact from events triggering their business continuity plans. That said, supply chain business continuity programs, I think, are relatively recent among providers, including, as shown in this pie chart, the same survey questions that we just took as a group. HERC provider members indicated that 1 in 5 lack a formal program, and nearly 2 in 5 have a brand new program. Most respondents did share that they have an active event monitoring process, but only 1 in 3 have dedicated staff to support an overall formal business continuity program. Communities like HERC seek to collaboratively mature capabilities in this space, with recognition that strong supply chains require that strength from end to end. That includes the supplier role as well as the provider role. And that is one of the key purposes of the HERC community. Nancy and Christine, as we continue to progress through today's session, have any questions come up in the chat, because I would love to cover those in real time when possible.
We don't have any questions yet, Jesse, but we'll certainly share them with you as we go along.
Great, no problem.
And please, everyone, just make sure you throw your questions in the chat and we will share them with Jesse as soon as we see them.
Thank you. And we have 2 more group questions then. To what extent do you agree or disagree with the following statement? Exchange of information between my organization and trading partners is robust, such as timely and actionable. This question seeks to understand if data exchange between trading partners meets or exceeds expectations. Please choose the response that best fits your experience. So on a Likert scale from strongly agree to strongly disagree. In the next 20 to 30 seconds, please make your choice and choose submit. My comments may be a little late relative to our time remaining. If you're a supplier, you can think about your sub-tiers. If you're a provider, you can think about your distributors and suppliers. All right, relatively a bell curve response with 41% suggesting neutral. The second most popular response being disagree. That's what I would have anticipated. If you have anything that you'd like to share in the chat as we move to our 4th and final poll, would be happy to converse together. Let's then move to our 4th and final question. To what extent do you agree or disagree with the following statement? My trading partners communicate with me transparently and proactively. This question seeks to understand if information exchange between trading partners meets or exceeds expectations, with a focus on communication. Please choose the response that best fits your experience. Here once again are our options. Go ahead and make your choice. You're welcome to reflect on the last 12 to 18 months, or more so in general. Just a few seconds remaining. Great, the poll has closed. Similar to last time, but a little bit more peaky in the middle, with 55% suggesting neutral. And then the next most popular response being disagree. So fairly similar to the responses from the previous question.
Jesse, I do have a question from the audience. This is Nancy.
Hi, Nancy.
We have a question. How do you define robust information exchange between providers and suppliers? That seems like $1 million question. And how does HERC assist or plan to assist in improving that communication?
That's a fantastic question. Well, for me, robust, yeah, that's an adjective that it's kind of up to interpretation, right? I think that has to do with the candor, the timeliness, the actionability, and the way in which it enables a collaborative response, either to potential events or actual events. Again, the focus of today's topic is with supply chain disruption management. And how does HERC seek to play within that space? I think I have some great examples for you upcoming, but one example is our event monitoring model. And so we use a model that's similar yet unique within the healthcare space that couples both technology-supported communication between trading partners, as well as guidance and encouragement for live conversation, including our position statement on resiliency, which I'll show you soon. So I think several examples upcoming in today's presentation will help to address that question. Thanks for asking that. Great. Well, now, again, prior to the questions, the previous questions jive with the KPMG provider assessment recently taken by our provider members. In the bar chart, you'll see the voice of customer suggests dissatisfaction with the level of proactivity and transparency in terms of communication between trading partners. Likewise, 40% of our provider members indicate that data exchange between trading partners is on the whole poor. I think that relatively is on par with the responses that we saw today. Not surprisingly then, if we presume within the context of partial communication and partial transparency, providers may tend to stock up as much as possible, which can further strain the value stream and confuse the demand signal. Furthering trust and transparency leads to a more balanced and effective resiliency strategy. HERC, as a provider-supplier collaborative, seeks to promote this necessary transformation and includes very candid and relevant topics such as the ones that we're discussing today. And I'll pause for a moment to see if there are any questions before we move to our next section. And silence will be a no.
Yeah, I don't see any questions out there right now, Jesse, but I'm sure folks will have some as we go along.
Okay, no problem. Well, now I'd like to share with you some examples of what HERC is doing, and I think that'll relate also to our earlier question. Some initiatives currently underway include an event monitoring model, supply chain mapping, a business continuity risk assessment, and a supplier resiliency scorecard. The latter being unique. I'm unaware of any other groups pursuing a similar strategy. In the following slides, we'll take a deeper dive into each. Our members recognize that supply disruption events are inevitable, and purposeful and collaborative response increases calm and confidence. In this spirit, we recently completed an initiative to reduce noise and improve value through automated event alerting. Providers and suppliers distilled key attributes of success, including a focus on critical products, primary sites, and significant events. Configurable settings help us to achieve these objectives. Our members weren't satisfied to adopt a general solution. They needed something designed specific to healthcare. Member testimony supports the premise that targeted communication leads to more confidence. So we have 2 slides on this topic. And at the end of this slide, I'll go back to the previous to collect any questions on the topic of event monitoring. Our members constructed this workflow diagram to elucidate the event monitoring workflow and opportunities to achieve the objective of increased value and reduced noise. HERC encourages suppliers to work with their customers to tailor communications such that the right frequency and specificity is achieved. Event monitoring requires a balance of automated support as well as live dialogue between trading partners. We appreciate Supplier Solutions for implementing these enhancements desired by our members. Success is when we collectively find win-win solutions to common problems. So as shared, for those of you that are using event monitoring, unsure of what it is, or curious about how the HERC model is unique within this space, I'll just pause for a few moments to see if there are any questions or comments.
Jesse, we've got a couple of questions. First,
Yes.
we've got a question from your experience. What is the biggest inhibitor between providers and suppliers that prevents information exchange and transparency? What's kind of the biggest thing that's getting in the way? And then when we get after that question, I've got another one for you.
Yeah, I'd suggest the biggest hurdle is fear. I think there needs to be trust and confidence bidirectionally that when bad news needs to be communicated, it won't lead to a knee-jerk response. And so we've been very forthright within our hybrid community at HERC, including overall 20 providers and 10 suppliers and growing, that we need to be rational and reasonable. And if providers want more candor and they want more transparency, we also have to be committed to calmness and coordination. If that adequately addresses that question, I'm ready for number 2.
I think it does, Jesse. I think it comes down to psychology is what it sounds like, huh? Getting our fears in order.
Yeah, I think another barrier is knowing who to reach out to. The chain of communication can get harried very quickly. And so, for example, the earlier pulse question that we had on a provider incident command structure, that really helps with triage of communication on the provider side. It's equally important that we have that same triage structure on the supplier side and know who are the roles and responsibilities to make those outreach so they're not duplicative or conflicting, so that we can get just the right information at just the right time, which is one of the reasons we use technology to support that objective.
Excellent. And so I do have the next question, which is related to recruitment for HERC. As HERC is recruiting new provider supplier members, do you have a preference toward organizations that are more or less mature in business continuity, or does it not matter? Are you taking all comers?
All are welcome. If you feel that you're mature, you're probably a bit on the rarer side. So if you're feeling immature, this is exactly the place for you. And I think we have a very healthy blend of those who are just beginning or perhaps are several years into it. We're also finding a lot of cross-pollination of perspective and strategy in learning how resiliency applies similarly as well as uniquely across the provider supplier spectrum. And I don't want to start my recruitment too soon, but you knew this was coming. Associate membership in HERC is free. So I would suggest that if you're interested or curious, there's really nothing to lose.
Excellent. Thank you.
You're welcome. We'll move to the next section then. Supply chain mapping is one type of transparency exercise which informs the overlay between locations with critical supply chain assets and world events. Once again, our provider and supplier members took a collaborative approach to define the objectives and salient principles. HERC understands that geographic diversity is just one of many resiliency strategies. Suppliers are encouraged to speak to additional methods of hardening the value stream. HERC does not ask for excessive detail, while our members desire to peel back the onion in future phases. It's important to maintain a sensible and scalable approach. Just like before, I'll have this second slide as a companion to the topic, and then we'll go back to the prior to collect any questions or comments that you may have. Through the collaborative efforts of HERC, 100 suppliers have shared mapping information directly with their customers over the past 2 years. I'd suggest that 2 years ago, the map would have had relatively 0 locations, as it wasn't something that was typically asked for, and it wasn't something that was typically shared. This has resulted in over 2,500 individual healthcare production and distribution locations mapped worldwide. Likewise, 65 suppliers have provided risk assessments. And when I cite supplier, I mean strategic and vital suppliers. As a community, HERC settled on a common list of 100 suppliers that are relatively important to all of our members. Thus, the information that's being pursued by individual customers is of keen interest to them and is shared confidentially and privately at the discretion of the trading partner. This level of industry engagement was achievable only through a partnership approach and genuine interest in supplier needs, including data autonomy and security. As always, suppliers maintain full control of their data, including the power to fully delete it at any time. I might suggest I'm not aware of any other forum that offers that feature other than HERC. All information is permissioned solely by the supplier to customers of their choosing. Literally, HERC nor the third party has any control to see the information, control the information, or provision the information. Only the supplier has that authority. Standardizing to a common technology has greatly reduced the burden to suppliers and more rapidly increased the level of transparency experienced by providers. So I will back up to the previous slide and see if there are any comments or questions on the topic of supply chain mapping.
So Jesse, a quick question. So as you're doing these maps, the information is just being exchanged between a single provider and a single supplier, but are you aggregating the data across all the suppliers that are providing it and seeing any patterns, or are you not able to do that yet?
Individual members, as individual customers, could choose to aggregate the information. Really, the net information that's shared with them would be the aggregate for them. But HERC doesn't pull together information across multiple sources. HERC is just a facilitator of the exercise. We don't have any rights or privileges to the data. Your question on patterns, for example, Mayo Clinic's taken a look at the data that we've received that's been shared with us as an individual customer. And for example, if you look at tier 1, which is generally the store-facing brand, 50% of those sites that were shared with Mayo Clinic were domestic, and then relatively in equal distribution between Europe, Asia is the next two primary geographies, and then some really scattered, but including Central America. Any inferences or patterns beyond that, I think are still out of our reach, but will become more accessible as we continue to pursue this initiative.
Got it. And in follow on to that question, we've got another, which is the thought that mapping data would eventually go to a raw materials level, or what level does it go to now, and where do you see it going over time?
Yeah, I think that's a critical point. So there are some that are starting on day one, asking suppliers for the full kitchen sink. And in my opinion, not surprisingly, suppliers typically say, no, thank you. So there is no compulsion. It's a discretionary transaction. So I think jumping straight to raw materials is premature. I think first we need to set the culture, including a collaborative environment and some baseline level of trust. There needs to be clarity on data ownership, data management, data security, as well as a broader understanding of what is the purpose, what is the problem that we're solving, and how will customers use this information in a way that's mutually advantageous to patient care. So HERC is investing quite a bit of time over the past 2 years, really building out that narrative, building out that context and that education. So I would anticipate that HERC will move beyond our current phase in the next 1 to 2 years, which has been identifying critical facilities and product categories at those facilities to perhaps the next level, which would be individual products of interest. That's not a HIRC decision. That's really an individual customer decision. So we'll be responding to our member interests and socializing those interests and solutions with our suppliers. I personally don't think that raw materials will be mapped broadly or widely anytime in the proximate future. But perhaps a decade from now, if the culture has been fully adopted, that transparency is normative and necessary, and there's appropriate technology to make it efficient and relatively pain-free, I think that's reasonable to consider, particularly for critical products or supply chains that may be uniquely vulnerable. A fairly long answer to a very good question.
Thank you. That's all the questions we have for now, but I'm sure we'll have more as we go along. Thank you, Jesse.
Yeah, you're welcome. So through the collaborative efforts of HERC, our membership synthesized a supplier business continuity assessment based upon ISO 23001. Multiple providers, suppliers, and collaborators were consulted over the course of 18 months. The resulting model offers a simplified and scalable approach. Continuity of patient care is dependent upon the resiliency of the end-to-end supply chain. Evidence of a formal and active business continuity program increases clarity and confidence between providers and suppliers, with the ultimate focus being a stronger supply chain. Offering a template for resiliency assessment provides a common standard and starting point for understanding supply chain disaster preparedness. Many of our members have made this exercise a routine expectation of their trading relationships. Again, like the pattern before, I'll review this slide and then back up for any questions or comments. And Nancy, I had a clock running, but can you remind me where we are in today's session in terms of time?
We're at 2:35 Central Time, Jesse.
Thank you. The HERC model is derived from Supplier Solutions' 5-tier approach. Responses that identify gaps in fundamental business continuity practices suggest a maturity toward the beginning of the pyramid. We are actively evolving the assessment based upon industry collaboration and pilot. Supplier Solutions makes this assessment available at no charge to HERC members. I've mentioned Supplier Solutions a couple times. HERC is technology agnostic, but we have a preferred relationship with Supplier Solutions. Therefore, HERC members can choose no technology or any technology. The reason I highlight this particular one is it's the technology that most of our members have selected and where most of our collaborative synergy has evolved. With that clarification, I want to call out that rather than designing a laborious assessment and forcing it on suppliers, HERC invites suppliers to collaborate with our providers on an approach that is sensible, scalable, and achieves the appropriate outcomes. And where we're at currently, the assessment is roughly 36 questions. The first version was yes, partial, no, to do you have or do you do questions. And we are now evolving some of those responses to include some sort of proportionality, such as yes, 80% of the time, or yes, 60% of the time. So again, we're continuing to evolve our approach. Does anyone have any questions or comments about resiliency assessment?
I don't see any questions right now, Jesse, but I'm sure we'll have, as I said, I'm sure they pop up when we least expect it. So if anyone's got any questions about anything we've talked about so far or anything regarding resiliency and where we're going in this collaboration, please let us know.
Much appreciated. So then, as a last example, HERC is taking a leading role in translating the resiliency attributes discussed today into a balanced resiliency scorecard. The primary categories include transparency, communication, preparedness, and performance. Emphasis is placed both on the quality of information provided, as well as the candor and completeness of live dialogue. As always, these conversations are confidential between trading partners and purpose to promote recognition and growth of supply chain resiliency. If you haven't picked up on it yet, the HIRC approach is big carrot and either no stick or very little stick. HIRC is carrot, and our members choose if they need to add any additional expectations within their unique commercial relationships. Our members wish to elevate the topic of resiliency in commercial relationships, discuss measures that inform current state, and collaboratively work toward a stronger future state with those relationships. As a starting point, we're using a pilot approach to help shape and refine the method to ensure that it's accurate, meaningful, and fair. So I'll pause just for a moment to see if there's any questions about HIRC's approach to the resiliency scorecard and how we're looping together all of the information previously discussed so that it can be more visible in commercial relationships. It can help to elevate the topic of resiliency. It can also empower providers to be better informed on the resiliency planning and preparedness of their trading partners, and if so desired, preferentially select or at least be informed during their selection process.
Jesse, I have a question that's a little broader, not just about the resiliency scorecard, but more about how you're measuring or reporting in general. And that is, does your definition of supply chain include things that go maybe beyond the traditional supply chain barriers, which would be things like utilities, water, medical gas? How wide is the definition of supply chain that HIRC is using?
Yeah, I think most of it would be those commodities, durables, drugs, the tangibles, whether it's a consumable or a durable, but it can include the services as well. So products and services. Hopefully that addressed the question.
And I think that they were specifically asking about utilities and water, I think kind of sort of broad facilities type issues that could be very critical in some kind of an emergency.
Yeah, I think that'd be important for the preparedness plans of all parties involved. So, business impact assessment, hazard and vulnerabilities assessment are examples of appropriate due diligence for an overall business continuity program that should be owned and maintained by each organization and each enterprise. But in terms of what HIRC is looking toward in the provider-supplier relationship, we're really looking for someone who needs a good or service and someone who's providing a good or service. I suppose you could say utility meets that definition, but traditionally, I think we're looking more for what is delivered on a semi-truck or other essential service.
Excellent, thanks. I think that clarifies.
Okay, super.
And I'll keep watching for questions while you continue.
Thank you. So our members have collaborated on the following position statement on resiliency. We are serious about our mission vision to promote a more transparent and resilient supply chain. In the coming weeks, we'll be releasing a final public-facing version with the names and logos of our providers and supplier members who support. So I won't pause on this slide too much longer, but I do want you to have a chance to read it a little bit, again, knowing that a public-facing version will be released soon.
And Jesse, just to confirm, because I should have said at the beginning of the event, we will be posting these slides on the SMI website for members to access, and we will also have a recorded version of this webinar for members to share with others on their team who weren't able to join us today. So this information will be available to everyone after the webinar.
Really appreciate that, Nancy. Thank you. So as we transition into our final segment, I want you to hear directly from our members. Provider members, including Allina Health, Baylor Scott and White Health, BJC, and Northwestern Medicine, point to the benefits of our collaborative model, our commitment to action, the call to protect continuity of care, and making real and lasting change. Supplier members, including Cardinal Health, Medtronic, Sandoz, and Sysmex America attest to the benefits of HERC's focus on developing resiliency standards, the bringing together of providers and suppliers, and our innovative mindset. Provider members, including Mayo Clinic, St. Luke's, Spectrum Health, and Stanford Healthcare, point to HERC's genuine collaboration, dedicated resources, our singularity of focus, and peer support model. And finally, supplier members, including Baxter Healthcare, Johnson & Johnson, Stryker, and W.L. Gore, speak to the tremendous opportunity to improve supply chain sustainability, our open and candid environment, and our desire to engage suppliers as trusted partners. Well, I wasn't certain how many questions we would have, so we are now transitioning to the end.
Jesse, we do have another question, a couple more questions that have come in. One
Okay,
is in
great.
follow-up to our previous question. Our participant is curious about the scorecard, and do you do it by location if you have regional locations with multiple hospitals, or do you do it by an individual institution that covers multiple locations? This particular organization does risk assessments and conducts them based on each facility. So kind of how do you manage a multi-facility risk assessment?
Yeah, so the resiliency scorecard that I was speaking to is respective of the customer's experience with their supplier. So it's not an inward focus, but it's an outward focus. It includes an assessment of that trading partner's willingness to be transparent, support event communication, share mapping and location information, to be candid and responsive when potential events are on the horizon, the supplier's performance in overall traditional operating standards, as well as the risk assessment that the supplier takes, which would be the ISO derivative that HERC and our members have developed. And then finally, the quality, candor, and completeness of a live dialogue session between that supplier and provider to ensure that there's clarity on what's important, current state, and where progress and additional hardening of the value stream can take place. So that's the nature and context of the scorecard that I was speaking of. Certainly, inward looking risk assessments are essential, and that would be a normal, healthy part of an organizational business continuity program. And I think the level of depth and breadth would be dependent upon your resources and the level of confidence that you wish to achieve. So certainly regional considerations are important, and then also a roll-up of overall strengths and opportunities would be sensible.
Excellent. And again, I think the facility question, maybe I didn't hear you right, but the facility question was pointed at, do we do this as individual parts of a whole, or do we do it as a whole health system at the roll-up level? And are you saying that's kind of depends on the organization and how they want to approach it? Or do you have a recommendation on that?
Yeah, so I really didn't cover that topic today, but it's still a great question. So, I'd suggest, well, make a plan, right? And if your plan is to take a look at facilities, utilities, supplies, services, staff, and other assets, your policies, your processes, the technology that supports that, everything, if you're going to that level of due diligence, which would be advisable, then I think there would be this vertical element and horizontal element to include your sites and regions and individual assets. And all of that should probably be tethered to an understanding of what's important, what's critical, what are your main services, what do you need to output at the end of the day consistently, and then align your assessment and risk evaluation accordingly.
Excellent, thank you. And Talon, I'm going to try to go on video just so I'm not leaving Jesse hanging out there by himself. So if you have a moment to put me back on video with Jesse, that would be great. Jesse, we do have another question. It says,
thank you.
what were some lessons learned about supply chain resilience from our recent experience with supply issues, particularly PPE at the onset of the pandemic? So, what are the lessons learned that sort of HERC is building on here?
I think one is there's a deficit in the desired level of resiliency of the overall healthcare supply chain. Transparency is lacking. Trust has a way to go. Digital enablement so that real-time operational information can be exchanged is another necessity. I think taking a all boats rise approach is essential, as opposed to being the first to race to the front of the breadline, where there's few winners and more losers. I think certainly there's concern over offshore dependence, including where there's geopolitical considerations, and the economic and regulatory elements that potentially have driven that phenomenon, and in what ways do we try to counteract that offshoring, and what is the right balance of geographic diversity as one resiliency strategy versus all of the others, such as optionality, appropriate thresholds of raw, in-process, and finished goods, and even just the agility of different assets and processes to pivot, knowing that disruption is inevitable. I suppose then, if I just kind of wrap up these thoughts, I'd suggest that the US healthcare industry has several Achilles heels, not just with PPE, but also pharmaceutical precursors that could be considered a national security issue, and many have said as much. So certainly, I think one of the roles of HERC is to ensure that all of these concerns, needs, and interests stay alive, that we can coalesce around a common definition of what problem we're trying to solve, and then seek to strategize and prioritize how we're going to pull forward, knowing that if we don't like the current state, we've spent decades getting here. So any change is not going to take place overnight.
Yep. And in that same vein, Jesse, we have another question.
Yeah, please.
Asking about, as we advance beyond the PPE crisis from COVID, what are the areas of risk right now that HERC's looking at? What should we be concerned about, as the most urgent crises that we should be preparing for?
Oh, there's the $1 million questions. Well, that HERC has a crystal ball, and we only let members look at it.
Well, there you go. There's the power.
Yeah, exactly. Well, I'll bring up one, sterilization, ethylene oxide sterilization. That has been a concern of Mayo Clinic leadership, as well as several of HERC members. As a utility or service that's necessary to over 50% of medical surgical products that we consume domestically, but that infrastructure is very much at capacity and is under quite a bit of regulatory pressure. And so there's uncertainty regarding that capacity, or at least there's diminished confidence. This is not a Chicken Little moment, but it is something that we're quite interested in, and really wanted to consider both a public and private approach to better understanding the problem. And if it's more than just what we can do inwardly, but is that also something that's appropriate within our governmental channels, whether that be the FDA as an example. I don't have the front page of tomorrow's newspaper, so I really can't suggest anything specific beyond that. I would share, though, from Mayo Clinic's experience that our overall rate of back orders has tripled from middle of 2018 to present. And that trajectory was very evident even before we hit 2020. So I think in general, there's a concern about the level or frequency of back orders. And one of the things we want to do as a community is to better understand that from a metrics perspective. And then can we pinpoint our efforts?
Excellent, excellent. And a little bit more of a granular question about HERC, Jesse,
Yeah.
and then I think this will be our last question. Like I don't see any other ones popping up. If a member chooses to join as an associate member of HERC, what are the ways in which they can engage and participate? What are those levels of participation for an associate member?
Oh, I love that question. Thank you.
And it wasn't mine.
I thought all of these were yours.
No.
So we have monthly member calls, and that's just really bringing peers together. And that includes presenters or table topics, as well as a roll-up of different initiatives that are in progress. You saw several of the initiatives as examples shared here today. So those happen on a monthly cycle as well. So if you're in 4 of those, you can be in I think we have 8. You can be involved in as many of those as you would desire. We have an online forum that allows you to connect with members in real time. And then we exchange tips, tricks, artifacts, and know-how within the community with the goal of this is the right thing to do for the patient. So we really don't hold back any secrets. There's full throttle engagement. I think you would really enjoy it.
Well, we'll hope that our SMI members will continue to join, and we will certainly stay connected with HERC. I do have one other question. We want to, and this goes back to something we were talking about earlier, and this is going to be our last question of the day because we really are coming to the end of our hour now. But can you discuss the concept of having an incident command center for supply chain, and what does that entail?
Yeah, so that would include a healthy understanding of when operational norms are out of balance. So what types of metrics or communication mechanisms does your department organization have to signal that we may have a problem? At Mayo Clinic, for example, we have a number of tools and templates and procedures that formalize what are we seeing, what does it mean, what's the probability, the impact, the risk, the scope, the scale, those types of considerations. And then we have multiple levels of escalation from huddle to multidisciplinary review to department leadership, and then eventually up to enterprise leadership. If we choose to activate the supply chain specific incident command structure, that's really, in many ways, it's a mirror image of what most enterprises are doing, but focused tenaciously on communication with healthcare providers and clinicians within the organization, and our array of suppliers and what they're seeing, as well as our procurement and operations teams to have a better understanding of what is the pulse. And we have a variety of different dashboards that have been built in Tableau, for example, that give convenient indications of red, yellow, green, and help us to inform enterprise leadership of risk and inventory health.
Excellent, wonderful. Well, that's it for our questions for today, Jesse. As I mentioned, we will publish the recording of this webinar on our SMI website in a few days, and we will make the slides available as well. And you'll get the bonus slides at the back of Jesse's presentation, which include a little bit of appendix information that we won't be reviewing on the call today. But I wanted to thank you, Jesse, for taking the time to join us today and share some insight on HERC's work and where you're going. We've really enjoyed hearing from you. I know the members are appreciative of your taking the time to do so. And I want to thank our members and guests for participating today and for your excellent questions. We look forward to seeing you on our next SMI webinar, and for our members to seeing you in Nashville in October. Thank you very much, and we hope you have a great rest of your day.